Too many Sri Lankan women live with pain. Heavy bleeding, constant bloating, pelvic discomfort, silently endured, often ignored.
Chronic pelvic pain affects up to 25% of women globally. And what is chronic pelvic pain? So it is a condition where the women get constant or intermittent low abdominal pain or pain in their pelvic region for the duration of more than 6 months. And there are a multitude of underlying causes for chronic pelvic pain, which I don't want to discuss today. But I would like to introduce a case of a 47-year-old woman who had been suffering from chronic pelvic pain for more than 1 year duration and also associated with severe painful menstruation. And we did an ultrasound scan of her abdomen and the pelvis, and these are the findings I would like to draw and show you. So this is the womb. Her womb was of normal size, and we found there is a large left side tubo-ovarian mass. So this is the tube and the ovary involving a large mass, probably attached to the womb as well, and it was around 18 to 7 centimeter size. And on the right side the tube was there, but this is the right ovary, and there is an ovarian cyst involving the right ovary, and it was suspected to be a hemorrhagic cyst, and it was around 5 into 4 centimeter in size. So our suspicion was a case of pelvic endometriosis, and we did the CA-125 level and it came out as 39.5 to rule out the risk of ovarian cancer. And based on her age, her symptoms, and the findings of bilateral ovarian masses, especially the left one, bigger one, and probably attached to the womb and the bowel. So we decided to do a total abdominal hysterectomy and bilateral salpingo-oophorectomy. So what is total abdominal hysterectomy? That is, we remove the whole womb including the cervix, and the bilateral salpingo-oophorectomy is you remove the tubes with the ovaries on either side. In this case, this was a little difficult surgery because, as we expected, she had, once we opened up, she had a lot of adhesions, that is, the organs sticking together. So that is common finding in pelvic endometriosis. So we found this left side tubo-ovarian mass attached to the bowel and also on the back side of the pelvis. So we had to do the surgery a little more carefully without causing damage to the adjacent organs. And so we completed the surgery maybe around in 2.5 hours time. And the next day she recovered fully, and we had to keep her for around 1.5 days, but she went home fully recovered. And also when the histology came, it confirmed our previous diagnosis of pelvic endometriosis. And in addition to that, there was a serous cystadenoma of the left ovary as well. And additionally, we have found out some adenomyosis and leiomyomas in the uterus as well.
If you've been experiencing abdominal pain for 6 months or longer, it's important not to ignore it. Seek medical advice and get the care you need.